Welcome back to another episode of One Clear Vision. My name is Nikki Csek. I'm your host, and I'm with Dr. Sophia Capo of ABC Optometry and Vision Therapy.
Good morning.
Welcome. Hello again. So we're on our fifth learning journey video. And today I have a really, you're so good at teaching us and keeping it down to a level that I can follow. So for eye conditions, my enormous amount of knowledge that I have there, the one is pink eye. I know pink eye. I've had 3 kids. They've had pink eye. What is it?
What is it?
Yeah,
it was really important to me today to talk about, just common eye emergencies and common eye, conditions that we see a lot in children. Pink eye is one of those things where, everyone has seen it. Kid comes home from school or daycare usually, and then one eye's red, both eyes are red. We're like, oh no, what do I do?
Glued shut.
Glued shut in the morning when you wake up. Yeah, that's another one. So in order to understand pink eye, we first have to understand kind of some of the tissues in the eye. So like mini anatomy lesson.
Okay.
So everyone knows the colored part of our eye. That's called the iris.
Yep.
Okay. On top of the iris, we have our cornea. It's a clear dome. It's like a little circle. It sits right on top of our iris.
Okay.
The white part of our eye on the sides, that's called the sclera.
Did not know that one.
Okay, that's okay. That one, it's not really important.
Okay.
And then on top of the sclera, there's actually a clear tissue. So if you were to go and touch the side of your eye, you're not actually touching the sclera. You're touching something called the conjunctiva. And it's the conjunctiva that gets inflamed or irritated when we get pink eye. So the medical term for pink eye is conjunctivitis, which is just an inflammation, an irritation of that tissue that sits on top of the white part of our eye. Okay.
And that's the tissue that moves. Like if we get something in our eye and we're yanking at it.
Yes, you can kind of pull it away a little.
Okay.
Yeah, that's it.
Yeah, okay.
So there's 3 main types of conjunctivitis. Now there's a ton of other things that
3 types of pink eye?
There's 3 different types.
I did not know that
of
either.
pink eye.
Okay.
First one, the one that we see that's most common in young children, especially children who are in daycare, is bacterial pink eye. So that's the one where you wake up in the morning, your eyes are glued shut, you have kind of like crusties, it's kind of like greeny or yellowy colored. It's usually in both eyes, and it lasts probably a week or 2, whether we treat it or not.
Okay.
This one here is the most common in younger kids only. So younger kids, I'm talking like under 5. Okay. The second type of pink eye is allergic pink eye. So this is if someone has, usually it's an environmental allergy, but it could also be, I went somewhere, I touched something, and then I touched my eye, like a new cosmetic product or a new laundry detergent, and you're sleeping on your pillow and you can get an allergic reaction in one of your eyes. The third type is viral conjunctivitis. So any sort of virus different from bacteria can also cause an inflammation of this tissue. So virus in this case can be like the common cold, or just you got a little like runny nose, you have a sneeze, you can get that type of virus in your eye. We could also get other viruses like the flu and COVID and all of those other ones. We can also get a viral component, a viral conjunctivitis component in our eyes. And it's important to note that each one of these 3 types of conjunctivitis has a different treatment. So it's important to discern which one is which before we start throwing an eye drop on it, for example. So bacterial conjunctivitis, that's the one that we can put an antibiotic, because antibiotics are used for bacterial infections. A viral conjunctivitis, we can't put an antibacterial drop on it. It's not going to do anything. Same thing with allergic conjunctivitis. We put an anti-allergy drop on it, not an antibacterial drop. We don't have antiviral drops. It's the same thing like when you have the cold. You kind of just have to wait it out. What we do sometimes is we can do like a cold compress for comfort, or we do lubrication drops just because the inflammation can cause just irritation, even though none of these conditions are usually painful, the conjunctivitis.
So if it is bacterial, and we need an antibiotic, do we have to go to our family doctor? Can an optometrist prescribe?
Yeah. We definitely can prescribe any eye-related medication. So optometrists are kind of unique doctors, just kind of like dentists. Dentists went to school, specialty school for 4 years about teeth. Optometrists went to specialty school 4 years just about the eyes. So any eye-related medication, whether that be an anti-inflammatory drop, an antibiotic drop, like an anti-allergy drop, any sort of things that we can put in our eyes or medication that might affect the eyes in some way, optometrists have the latest information about that. We go to all of these continuing education events. We learn about the new drugs coming out. There's different like tiers and levels of antibiotics. So we know when to use which one depending on how severe the infection is or what type of infection it is. So we're very, very great at prescribing the correct thing at the appropriate time.
So the extent of the eye condition, whether it's bacterial, allergic, or viral, is there ever a time that there's blood in the eye on the white that's serious that we panic and go to?
Yeah, so blood in the eye, a little bit different. So the pink eye term that we use is reserved for the clinical term conjunctivitis.
Okay.
And those are the 3 most common types of conjunctivitis. Now, sometimes, so you know how I said there's the white part of the eye, the sclera, and then there's the clear part that sits on top?
Yeah.
There's kind of space in between. And you said that when you said, well, sometimes you can kind of move it around. So sometimes what happens is we can get a blood vessel that pops in between that area. And what happens is it just fills up the area with blood. So it's a space between the white part and the clear part that starts filling up with blood. That's called a subconjunctival, so below the conjunctiva, and a hemorrhage, which is just bleeding. Okay. Now this always looks so much worse than it is clinically.
Yeah.
So like you will like look somewhere and it looks like your entire eye is bleeding on the outside. Things that cause this sometimes are trauma. So like you can poke yourself in the eye accidentally and pop one of those vessels. Sometimes people who do yoga, like if you're upside down for too long, or if you're like clenching too hard to go to the bathroom, you can pop a blood vessel in your eye. Typically, these don't have any treatment. We can't go in and like suck the blood out to clean it. We usually have to wait about 2 weeks for it to go away. But just because, so like if someone has that as a one-off, we usually look at it. We want to assess to make sure it's nothing worse. And then we say, okay, this is what it is. There's not really a treatment for it. If it doesn't go away in 2 weeks, then come back. But sometimes, for example, if it keeps happening over and over again, it can be a sign of a serious condition. So like it can be a sign that you have maybe a blood problem or a blood thinning problem or a blood vessel problem that we actually need to address further with your family doctor or with another specialist. So as a one-off, usually they're okay, and usually everyone will get one of those in their lifetime. But it can be a sign of more serious things, and so sometimes needs to be. Well, don't ignore anything weird that happens with your eyes. You only got 2. You don't want to lose any.
Only have 2. So we're sitting on the doorstep of back to school, and lots of kids, lots of activity. What kinds of injuries or eye injuries can occur, do you see, and when do we need, again, to come in and see you?
Yeah. So the most common eye injuries I see from coming home, like the after school kind of kid, is some sort of scratch on the eye. My favorite one that I had was a little kid who was playing basketball, and he went to go take a shot, and he actually hit himself on the drop. So he kind of like scratched his cornea again, which is that dome that sits on top of the eye. That dome, the cornea, is really, really sensitive. We have a ton of nerves in our cornea that make it
hurts.
Yes. So like that's why even just getting like a little fluff in your eye sometimes just irritates you so much, because we have all of these really, really sensitive nerves. So you can imagine if you scratch that part of your eye, then like that's going to cause you a lot of grief. It's going to hurt a lot. Now, optometrists actually have a unique treatment for this that no other providers do, and that's because we have access to it. But we actually put a bandage contact lens on top of a scratch. So you can imagine, let's say you got a scratch on your eye. but you need to keep using that eye, right? All day. So picture you have a scratch on your hand, and then every 6 seconds or so, you keep hitting your hand, because that's what our eyelid is doing to the front surface of our eye every time we blink. It's hitting it. And so what we do is we put a Band-Aid contact lens, which is like a clear lens, over top of the cornea. And what that does is it protects the eyelid from hitting that spot on the eye again. And eyes, especially little kid eyes, they should heal their scratches, if we do this properly, within 24 hours. So we put a Band-Aid on them for comfort. Like that kid that I had basketball practice that night, he went. And we put a contact lens over it. We see them the next day. We take the lens out, and usually it's like almost perfectly healed after about a day.
That's amazing. But
if we leave it and we keep hitting it, it takes longer to heal sometimes.
Which makes perfect sense. But I can tell you right now, if I left the office here and walked downtown and I asked 100 people that I passed, do you know we have Band-Aid
contact lenses? Yeah.
They would laugh at me. I don't think the general population knows such a thing exists.
Yeah, but it's a really, really cool thing that we use every single day, like when we're treating eye emergencies. You just never cease to amaze me when we get together. Thank you so much for making me smarter. Another thing that we see in kids when they come in, so scratches on the eye is super common. Another thing is something gets in the eye. So we call this like a foreign body in the eye.
Eyelash.
Eyelash, but more like an eyelash. Sometimes we can take out by ourselves. Okay. You know, you kind of just wiggle your eye a little until it gets out. I'm talking more like you get like a little bit of a rock, or like sometimes you get hit by like a tree and you get some debris in your eyes. Or sometimes it's like metal, something like dropped on the floor and it hit into your eye.
That's
these
serious.
things, we work very hard in optometry school, like learning how to remove these by leaving the least amount of damage on your eye. So let's say you have something that gets lodged in your eye. We are essentially going in there with our medical equipment trying to take out this spot. Because if we leave it in there, it can become infected and it can cause a whole slew of problems. So we're working really, really hard to try and get those tiny pieces out without leaving any damage to the rest of your eye. And optometrists, we do this all the time. We go through like units and units of school doing this. So we're experts in taking things out of people's eyes. We also have all the right equipment to do it. So like you come in and see us, like we're putting you in our microscopes that are seeing you in there properly. We're, flipping your eyelids to try and find these little things that might be stuck in your eyes. And we can get them out, and then we can prescribe the medication that you might need to let your eye heal. And we can do these things really quickly. Like at our clinic, we keep separate appointments every single day for kids who may have emergencies, who need to get in and be seen urgently.
Okay, so let's talk about that, because I think as a parent, so if my daughter's out climbing a tree, she turns and catches a branch or something like that, I think I need to follow a proper protocol. Do I have to have a referral to go to you, or can I panic and just call and
you can absolutely just call in, and we'll likely see like any child with an eye emergency. Like my staff knows we're booking those in same day, whether I have to stay later or like we keep some spots available empty every day to make sure that we get those kids in. Because like we said, like a lot of the times if we get, let's say there's something in the eye, we get that out properly. Fast. We can put, our bandage lens, or we put our appropriate medication on it. Like that kid's feeling better the next day or 2 days later. But if we wait, or, you're sitting for 8 hours at urgent care, it's easier. It's easier. Just come see us. We can get it done really, really quickly. And then it's simple.
It's dealt with.
And then a really, really great thing that a lot of people don't know about is that if we, as an optometrist, find something that, let's say, needs a specialist's attention. So like someone comes in, we have an eye emergency. We're like, you know what, this is bad. This child might need, to go to BC Children's, or they might need further surgery, or they might need anything else. Optometrists have the fastest triage to get to the eye surgeons. And the eye surgeons work with us every single day because we're the primary eye care providers. So we know after the eye surgeons, the optometrists know the most about the eyes. And so we're primary eye care, because you can't see a surgeon unless you're referred by someone else. And so when you come in to see us with an eye problem, like we have the eye surgeons on the phone, whoever's on call or whoever we know can deal with the problem. And we're saying, hey, I have this patient right here. This is the severity of it. Because we, in our training, learn, what needs to be dealt with first, what can wait till tomorrow, what can't wait. And we have this direct line of communication with the eye specialists to say, hey, I have this child who needs to be seen right now. This is what I've tried already. Or, can you see them today or tomorrow? And we get children in who need to be seen. And it's faster than if you were to go to the emergency room or if you were to go to urgent care or wait a few days to book an appointment with the family doctor.
So when Dr. Capo says 911,
yeah,
like if the surgeons are
people, when we find an emergency, when I find an emergency in a child that needs urgent care, like I am calling the pediatric eye surgeon, I'm calling the pediatricians, I am calling everyone that needs to be called to get your child the attention that they need. So
on that note, last question that I'm thinking is what or can eye problems tell you about a more serious condition? So I, as a parent, I don't think it's serious, but something's not normal.
Something's not right.
Something's not right. Normal, that's not what I meant, but something off.
Something's off. So, and then we said there's pink eye. So pink eye is what usually people think of when your child has an eye that looks red. Okay. But sometimes your child can have an eye that looks red that isn't a form of conjunctivitis. It might be an inflammation in the eye. Now, if we see inflammation in the eye, that's actually very serious in children. We can't find inflammation unless we look in the eye with our special microscope equipment. So they don't have that equipment at your regular family doctor office. They don't have that equipment at the pharmacy. So we need to look for this specific type of red eye that's actually inflammation, because that can mean an autoimmune disease in a child. I've diagnosed countless times like pediatric arthritis from finding inflammation in the eye, and then they go on to get treated by the appropriate specialist after that. Sometimes the pressure in the eye might be too high. And they might be having like a painful eye and it looks red, but it's not conjunctivitis. And it's because the pressure is really high. And we would never know that unless we had the equipment to measure the pressure. And then that's just the surface of the eye, right? What about when we look on the inside? Like there have been cases where I look on the inside of the eye and everyone has an optic nerve, which is kind of like a wire that connects the eye to the brain.
Okay.
And that optic nerve looks a little bit off. Like it looks a little bit off. And so we send that for further testing and it comes back that the child has a seizure disorder, or it comes back that the child has a brain condition that needs medication, that needs treatment. Or if we see that the optic nerve is swollen, sometimes children have like headaches, like really bad headaches, and it can mean that the back of the eye is swollen. And that's an eye emergency. That's a brain emergency. And so we're the ones who are looking in and who are finding these things and then who are sending them off to the appropriate professionals to get their treatment.
So Dr. Capo, and I know I said last question, but every time you say something, I end up with like 3 or 4 more questions. So is this looking at the eye, the optic nerve, the inside the eye, is that again part of the gold standard you're trying to teach me?
Yeah, absolutely. So remember we put those eye drops in children's eyes, and the reason that we put the eye drops in is to relax the focusing system so that we can get the most accurate, best measurement of the glasses prescription. But a side effect of those drops that block the focusing system is that it opens up the pupil. So when the pupil's opened up, we can look inside very, very easily, and we can see any of those health things that might be there. And I don't want to freak anybody out. I don't want to scare anyone, because these things are rare. They are rare, but they happen, and they happen sometimes without you even realizing. Like the number of children that I've seen that don't know anything's wrong, and then we find something is more than a handful. It's a lot. And if we're not finding those, then like we're not doing our job. So like even though if your child has a red eye, and they're under 5, it probably is pink eye, Probably. But especially if that keeps happening, you know, or if you got put on a medication and now it's not working, or, you know, we got put on a medication and yet it's been longer than a week or so and it's still there. It's not going away. We need to start thinking in our heads, something else might be at play here. Did I go to the right professional to look? Did someone actually physically look at my child's eye to try and make a diagnosis? Did we rule out a bunch of other bad things before we jump to our diagnosis? We make, like clinically, I'm making diagnoses based off of what I'm seeing. So a child comes in, even an infant, we're like, okay, let me look at your conjunctiva. Let me pull down your eyelids. Let me check under your eyelids to make sure that there's nothing there that might be causing you this red eye if it's not just a generic bacterial infection. We're not doing that just based off of a history. We're not just talking to you saying, well, what happened? Because kids often can't really tell us what happened. So we need to use our skills and our objective findings in order to make a diagnosis. And we can only do that if we have the right tools. And so when someone comes to see me, we're going to check the actual eye. We're looking directly at the eye, and we're going to make the correct diagnosis and prescribe the correct treatment rather than just using our best guess.
It's amazing.
It's fun.
I have a whole bunch of takeaways from today. I have my favorite, that there's an eye Band-Aid. 3 different types of pink eye, didn't know. And the amazing ability that you have if we just bring the kids to you. I don't need a referral. Anything I think Dr. Capo and give you a call and
you'll get it done.
You'll get it done. Thank you so much for sharing with us again today. And we'll see you in a couple weeks.
For sure. Thanks.